Two of my friends, Scott Sheridan, he's the head trainer of the Philadelphia Phillies, and Angela Gordon is the physical therapist for the Washington Nationals. These guys are at the top of the game, so we have definitely questions, and I want you guys to jump in with a lot of questions. And there's a lot of ATCs, and there's a lot of parents here and coaches. So, and then we're going to try to touch into who are the people that are at risk. How do we keep them out of it? And Scott and I, we used to work for Phil Donnelly. He's like the grand poobah of shoulders, right? When you, I mean,
Grand
for
poobah's a good one.
yeah, that's a good way. But I mean, he's 80 years old. He still sees 20 pitchers a day. I work with him on Saturdays, and there's not a day that I don't learn a million things from him. So we'll try to give you some insight. Everything we do, almost everything we do in rehab, at least in the therapy side, Phil Donnelly's had kind of an imprint on that, or somebody that he has put out there, and he's had a part. So we can try to give that knowledge to you guys tonight quickly. But I know what these guys do is a lot, and we don't see that as fans. But Scott, if you can go and tell us what a day is like for a Major League Baseball trainer, that would be awesome.
Yeah, I mean, Billy talked about it. I wish he was still here because I had a question, but I didn't get to raise my hand. But normal day for us is usually arrival at probably noon or 12:30. And so for players, figure at a home game, 7:05 game, you figure on the field by 4:15. So really from 1 to 4, we're doing all our prep stuff. So we have pre-established routines for our players to go through. They have a prep program that they start with every day. They do our work, whether it be shoulder care or position player or lifting or whatever. Usually they're in the cage probably by 3:15, 3:30. Pitchers meetings and things like that occur. And then by 4:05, 4:15, they're starting to get themselves on the field. They're on the field pretty much till about 5:30. They come back in. We have our starter, usually an hour before the game, has some kind of routine he's either doing with me or one of my assistants. That takes us right into game time. Unfortunately, when the game's over, we can't just pack our crap up and go home. We usually have post-game workouts or lifts or whatever, so it ends up being pretty much about a 12-hour day. You know, I'm usually heading out to go home around 11:30 or midnight to get back home.
And Angela?
Thanks, Steve. Well, my role is a little bit different, and I know Scott's a PTATC, so their organization's a little bit different than what we do as in the Nationals. But I'm there on a part-time basis, so I cover 40 home games during the season and go to spring training for 2 weeks. But I normally get to the stadium around 2 on a home game, and I'm there till game time or slightly after, depending on how many guys need treatment or work or correctives. And sometimes I get called in earlier to see more guys, depending on our injury load. But I typically go in and I see our DL guys, I see post-ops, I see typical rehab stuff, and then there's a slew of guys that just come and do daily maintenance. Our veteran guys are pretty intelligent in the way that they need to take care of their bodies, and they know what they need to do. So part of that and part of what I need to do is help them and keep them moving, and whether it's treatments from dry needling to just corrective exercises and mobility exercises. And sometimes I coordinate with our pitching staff if they come to me and ask me questions, because there's a lot of talk about mechanics. And part of what we need to do as rehab professionals is look at if somebody isn't able to get into good mechanics, well, why? And, there have been several incidents this past season that we worked a lot with several of our guys in correcting their mechanics. And from my standpoint, correcting whether it's an ankle, hypomobility or spinal instability to help them be able to correct their mechanics. So coordinating between everybody and being there for most of our guys who need anything and want to come.
The biggest question I seem to get when I have young pitchers in the clinic is, when do pitchers do their strengthening exercises when they're in season? Relievers compared to starters.
Yeah, so the easy ones are the starters, because you know what you're doing. It's every 5 days or every 6 days they're gonna do their routine. For me, we do strength pre and post throwing. So there's a lot of issues that people say, well, I can't do strength work before I throw. My thing is, if you've always done it or if you do it on a regular basis, then you can do that. If you decide that middle of the season you want to start a strengthening program pre-throwing, well, then you're kind of out of luck. So from my standpoint, it's having that plan in place. As long as you got the plan in place, you can do that. So we do strengthening for our pitchers pre, and then we do strengthening with them post-throwing also. So for a starter, if it's a game day, probably a little less strengthening stuff that day, but post-game, there's usually some kind of manual resistive exercise or tubing program or something that I'm doing with them post-game. Relievers are a little bit quirkier. They have a little more, they're just weird. I'm not gonna lie, they're just weird. They don't want to feel too loose. They don't want to feel too tight. So a lot of times we kind of have to feel them out a little bit more. For most of those guys, our rule of thumb is if you pitch in the game, you have to do something with me post-game. That might be a stretch, that might be an exercise, that might be whatever. But for those guys, we probably tend to do, I'd say, 60 or 70% of their strength work is post-game. Again, they're a little quirkier. You'd think they got 8 innings to recover or 5 innings to recover, they'd be okay, but they're just different.
Also question, how many times do they strengthen a week? You know what I'm saying? Is it after every start? Is that it? Or do you do anything like 2-3 days down?
No, I mean, in a 5-day rotation for a starter, we do the day after pitching is their heavy day. So that's usually some kind of total body workout. The next day after that's a bullpen day. That tends to be a heavier upper extremity day for us. And then we do another total body day the next day. And then they have the day before they start is usually a lighter kind of maintenance day. I guess is probably the easiest way to put it. That's typical. Not everybody follows that, but that's typical. For relievers, again, we go by their schedule, Steve. I mean, it depends on how often they pitch. I mean, if they've pitched 3 in a row, obviously we change the routine. If they've pitched back-to-back, whatever. If you're like the 12th guy on the rotation and you haven't pitched in 10 days, we tend to do a lot more with you.
Big question. What do you guys feel is important for strengthening during the season? Like, what muscle groups are you? I know all of us are big core people, but Angela, if you want to, and then Scooter.
Start.
Well, for me, a lot of things. What I need to do is make sure that they're doing their arm maintenance program and their scapular work. When these guys get injured and they come in the clinic, and I'm like, okay, well, what are you doing for your scapular program? They're like, what's that? I mean, I had a major league guy this year who has first year out of Tommy John, and he's never done a scapular exercise. I'm like, how do you make it this far and never do a scapular exercise? So I've been a big proponent and a big nag to a lot of the guys to do their scapular programs, and a lot of them after a year or two finally realize and see the benefit of doing it and stick to it. And I've had a fortunate situation to work really closely with our strength guys who incorporate that program into their daily weight workouts too, so it gets done, and we have a team approach to everybody be on eyes to get that done. And some of the other things that we've incorporated over the years is a hip and a core maintenance program. Our strength guys were really good about power and keeping their core strong throughout the season. And my philosophy comes in, and what I coordinate with them is to make sure that they have the building blocks to be able to do that. The sport is so highly rotational, and these guys have a lot of spinal instability. So if they don't have the building blocks and the core stability and the static stabilizers activated and know how to activate it, know how to have that body awareness, well, that's my job to come in there and get that done for them. And then the strength guys can build on top of that. So those are my 2 biggest things that I look out for.
So I think she covered pretty much most of the things you think of. I mean, scapular work probably gets talked about the most from a shoulder perspective. Probably something that we look at the most. Just common sense approach is that scapula is going to be part of it. Certainly core is important. Certainly glutes. None of us want to end up like Tiger and not be able to fire our glutes. But I think the thing that really gets missed is that most exercise programs, the faulty part of most exercise programs are that they only work in one plane of motion. So if somebody does squats all the time, well, they're working in what's called sagittal plane. They're working in just this front plane of their body. And the problem with that is the game doesn't happen in one plane. So your exercise program has to be in the multiple planes. You have to work transverse plane around your body. You got to work frontal plane, and you got to work sagittal plane. And so I know that sounds like it's really like high tech, but it's not. Just you rotate the throw, you got to rotate the exercise. You can't create, even for my scapular exercises, they include some kind of other plane of movement other than sagittal plane.
Along that point, what about stretching? How frequent are your pitchers stretching? I know how we train the younger kids, and how much we want them to stretch, but how much are you guys making sure that these guys are doing their sleeper stretch or their hip stretches. I mean, if you can expand on that.
So we have a stretch routine for all our pitchers. Probably takes between 10 and 12 minutes to go through. And it includes everything from scapular mobility to shoulder internal rotation, external rotation, to glenohumeral mobs, thoracic mobility, pec minor, you name it, we hit it. And for me, Steve, it's really about identifying those areas that need to be stretched and focusing on those. So even though it's a set routine of stretch, I kind of know what I need to work on the most for that particular pitcher, whether it be internal rotation or pec minor or whatever it is. So most of our guys, we try to touch them, and I say touch them, gotta be careful. Good touch, not bad touch. Try to, well, after the turd throwing thing, I thought I can't go wrong, this is great. But we try to touch, our relievers, we probably try to touch them or do some kind of stretch routine with 3 or 4 times a week. And for a starter, it's somewhere between 2 or 3 times within that 5 days.
Well, I think my role in the stretching aspect for these guys is a little different because I'm not there on a routine basis. So, but from what I see with our team is they have their normal routines that they go through on a daily basis, whether it's a starter or a reliever, or if it's our infielders or outfielders. They have stretching routines they go through with the strength coaches, with the trainers. From my standpoint, what I try to aid in each individual of the athletes is looking at what kind of body composition are they. Is it an athlete that's a really inflexible athlete that needs to concentrate more on mobility activities to maintain themselves over the course of the season, or is it an athlete that's really mobile and hypermobile in some areas and not necessarily have to stretch unless they're starting that day, but really focus on all the stability and strength work to maintain their body. So I try to help identify those differences in the body composition and tailor their programs to what they need specifically for their individual systems.
On top of that, just with mechanics too, everybody is individualized. There is no perfect mechanics. I mean, we have, and we'll go over it at the end real quick, like, I think we've got down what we think causes certain injuries, but everybody's different. So I think you need to remember that there is no, it's not perfect for everybody. Just like Scott said, you focus in on what some guys have limitations in, and you hit those, and then with the mechanics, we focus on what, and we'll go over that at the end real quick, but my job is to get, just with that labrum thing, going back to what Dr. Murthy said, I think the reason that we've been trained to get our labrums back is that we don't let them go back unless we've corrected what they did before. The guys that go back and throw the same way, they don't make it. We don't let them leave the clinic unless they've got it down. So it may take us a while, and the guys that work with me here, they've seen some of my guys, minor leaguers, and they'll throw things, and then they'll leave for a day, and then they come back, and then they leave for 2 days, and then they come back. Eventually, they realize they can't throw the way they used to throw. So I didn't get a chance to expand on that we can get them as strong as we want, but if we don't address, even with the Tommy Johns, if we don't address, I think the failure rate is so high because they've never addressed why they had the problem. And just on Scott's point is that it's individualized. Okay, so when you're coaching and you're playing, everybody doesn't throw the same. And we have some basic things, and we'll go over them real quick at the end. But that was just a point I wanted to add on to what Dr. Murthy said earlier. Big question, and Doc kind of talked about it, but do you guys use ice? I mean, that's a big thing.
Yeah, I mean, I use ice. But my usage of ice has probably changed dramatically in the last 10 years that I've been at the major league level. I see less use of it now. I probably use more contrast because I have it available to me. It seems to be a better modality for me to use. I would say if I had 13 pitchers on our roster when I started, I would say probably 70% of them used to ice, and I'd say now I'm probably at 20 or 25% of them icing. So to me, the bigger role now has been more some kind of active exercise, some kind of program for them post-pitching has probably been expanded, and the use of just coming out of the game and putting ice and sitting down and doing nothing has kind of gone away.
For the people that don't know what contrast is, can you?
Yeah, so
Just
I mean, we basically just use hot and cold water, some kind of differential of probably about 55 degrees at least in order to get, hot and cold treatment on the elbow. We usually create some kind of movement for them to do in the hot, and they just kind of hang out in the cold. We do ratios are usually anywhere from 3 minutes in the hot, 1 to the cold. Sometimes they're just 1 to 1. It just depends on what we're trying to do.
How do you?
Steve, is post that night, right after the start? I mean, is that what he's talking about?
Yep.
Yes.
Right after the game?
Yep. Post game.
Yep. Angel, your role is different. I mean, Scott's a ATC and a PT. So how do you coordinate between the different, like strength coaches, the ATCs, and you as a PT? How do you do that?
I talk a lot to everybody. Which I don't have a problem doing, so. But I kind of have that role that goes between, and I try to coordinate between both staffs because, a guy gets hurt, they're on the DL, they're with me initially for the initial rehab process. When they start baseball activities and they start transitioning back to the team, then whatever we've been doing in their rehab process needs to coordinate back to the strength people, back to the athletic trainers, and going forward. And that program changes over time, and we work with that program and we go forward, and as things pop up, we address it. But I do a lot of talking between the athletic training staff and a lot of talking with the strength guys. And over the years, it's been great. The strength coaches have been awesome. We've incorporated a lot of preventative programs, corrective exercises. They've gone as far as taking the programs that I've put together and blown them up and laminated them and put them on the walls in the weight room, because a lot of guys have adopted some of these stretching routines or stability exercises or mobility exercises. Because, it took a while, but over the years, a lot of the guys kind of realize how important it is in playing and maintaining their bodies. And so when a guy feels better and they do something, they're hooked, and it stays, and then it trickles down. But communication is huge for me, and I would rather somebody fault me for talking too much and communicating too much versus a player not knowing what they're doing, and a player coming back to me and saying, I don't know what I'm supposed to be doing because you're doing this, he's doing that, and they're doing that. So, getting everybody on the same page and coordinating between all team members on our medical staff is, I kind of feel like where my role fit in a little bit to help coordinate that, and that's from my perspective. To me, that's for the betterment of the athlete, and that's what my primary goal is.
Scared the kids off.
I know they
Scared
left on
away.
me.
Scared the kids off.
How do you tell who's at risk?
Yeah, so it's a big process for us. We're fortunate, got a lot of staff and a lot of time on our hands in spring training, but identifying the player at risk is priority one, and that happens for us in spring training, but it's really happening throughout the entire year. So, for us, you're looking at posture pictures, you're looking at range of motion of shoulders, you're looking at range of motion of hips. We're fortunate we do dynamic ultrasounds on our pitchers' elbows to look at what's happening there. Obviously the physician's exam has a part in it, looking at medical history. So the player's history tells you a lot about where they might be headed going forward, particularly now that we're in an environment as a club where we're picking up a lot more free agents. We haven't developed a lot of players that are making it to the major league level. So now we have to go out, and when you pick up free agents, you're basically sometimes picking up somebody else's trouble. So you have to kind of weed through that information. So a lot of it is looking at their medical history. You take that information and then you basically decipher what's at risk. For us, it's internal rotation loss that's greater than 15 degrees. It's total range of motion changes that are 10 degrees different than the non-dominant side. It's gapping of their collateral ligament greater than 2 millimeters on a dynamic ultrasound. It's basically red flagging all those things, their hips, core testing, the strength and conditioning guys testing, and you basically create, this problem list. To me, I think where labrum repairs in particular, we talked about that earlier. I mean, if you think about why they fail or why we fail in general in preventative stuff, is because we don't take time to make the problem list. We just kind of assume that, okay, well, everybody does this exercise program. It's a set program. Everybody's going to do scapular exercises, whether it be six-packs or black burns. I heard black burns mentioned earlier. I hadn't heard that term in a while. But we really get into throwers 10 I mean, I could take a thrower's 10 and throw it the hell out the window, to be honest with you, because everybody thinks if I just do the thrower's 10, I'm going to be fine. It's just not that simple. If you want to prevent the injury, you have to make the list. You have to make the problem list, whether it's whatever it is, internal rotation, whatever. So I think that's really would be my message, Steve, is that we have to do a better job of identifying the problems first, make our list, and then I think we'll have a better chance of being successful, front end and back end on those labor rooms.
For us, we go through, every spring training, I go down there for a week, and I spend a week measuring 40 guys, which is a very difficult feat to overcome. But like Scott said, we go through our checklist. I have a whole slew of measurements that I take between shoulder range of motion, hip range of motion, strength, scapular dyskinesis measurements. We go through some movement assessments and screens. The strength coach and I coordinate between some of the FMS and SFMA movement patterns to screen through them. And then if somebody gets identified at that point as having a problem movement, they'll send them back over to me, and we'll do a more in-depth examination to try and wean out whatever issues we have. And it's not just an isolated, let's measure, some guy comes in with shoulder problems and may have had a history of shoulder problems, and okay, well, let's just examine the shoulder. Well, no. We're doing a full kinetic chain evaluation, and we've done a lot of that this year with a lot of our guys, identifying injuries from ankle dorsiflexion range of motion through, lack of elbow extension. So we really try to go through a whole kinetic chain evaluation to identify all the problem lists, like Scott was saying, and try to correct things as we go along to help prevent and offset stresses that may be ending up in areas that they shouldn't be.
One more thing, and I guess one other point would be, when we look at, we will take time for our youth athletes to find someone to train them and to work on their mechanics. But you probably wouldn't take just a half hour to go see a therapist like Steve or somebody in the community that would just evaluate them for you and give you an opinion. And, I don't know what that costs because I don't work in the billing area of PT anymore, thank God. But, for me, I don't have to bill my patients. But, an evaluation from a physical therapist who gets it and understands it would certainly make as much sense as taking them to have somebody look at all these other things that we pay money to do with our kids.
And that is the perfect segue right into this.
As if I knew.
That was good. So we're going to give you a quick, our screen is comprehensive. We measure 150 things. Some of the boys in here have been screened by me. So we have a questionnaire that every player fills out. Then we're going to look at posture. We always look at the shoulder and the scapula. I'm a Morgan Cooper Donnelly guy, so I'm always going to look at the scapula. Look at elbow, wrist. We look at hip. Hip is huge in pitchers. Huge. We can look at hip tightness and we know exactly what they're doing before we know that they're going to open up too soon, they're going to open up too late. We know that just by measurements. Core strength is huge. We measure everybody's core strength. We do it a bunch of different ways, but I'll show you a couple real quick. We do screen them with the docs. We have the docs come in if we need them to screen them for something that we think could be a problem. And then the difference is we look at all that and then we look at them throw. Because there's a reason that they came to see me. And I can find out all the warning signs, but I also have to figure out what in their mechanics is a problem. Because when they're younger, I want them out of it. Even when they're older. So the term you may hear is a sick scapula. That's just your scapula's gotten tired, okay, and it's just in a different position. I'm going to show you a picture. The inferior medial border, and I'll show you in a second, it sticks out. They get their pain here because it's tilted, so their pec minor is on a stretch. So these guys are really painful here. And we're going to show you what a dyskinesis looks like so you can get an idea. All right, so this is a college pitcher. So this is lower, okay? Most of these guys, their scapula is going to be down. They'll be tight here. And we'll show you another picture in a second. This is the inferior medial border. This is sticking out. I already know their serratus is weak, okay? That's a huge thing. And Christina and I is Christina here? We measured all the Towson pitchers about 2 months ago. Every one of them failed. I've never had a pitcher geez, now since I've been with Phil, we've never had a pitcher pass the serratus test. Never, not one. These guys are extremely weak. We had two guys that came in today, and they were, macho and everything, and I just used one finger and pulled them down. Okay, so these guys get really tired and really weak. Okay, so if you see this sticking out and it's down, see how his shoulder is a lot lower. These are positive signs. Okay, see how tight this is? His teres is really tight. So I know this guy's GIRD, and we're going to get into that. But the back of his cuff and everything is really tight. So I know he's going to fail when we measure him. Okay? This boy happened to tear both his labrum. Left playing football, right playing baseball. Okay? So we look at them, we look at their shoulder blades statically, they're just standing still. We put them in 7 different positions. Then we look at them dynamically when they move. The videos are great because their shoulder blades fly out at you. Okay? So you know that they're what we call a dyskinesis. They've lost some motor control. Like I said, I do a lot of screens. I do about 500 a year. Okay? No one passes. Not even none of the major leagues. Brad will tell you, he pitches in the Cubs organization. When he came in after a season, we pushed him around. Brad throws hard, throws upper 90s, and he had a great year. But these guys get tired, okay? Especially the younger kids that are, you wouldn't be shocked. This is something that builds up over time. This is not something that just came. When I ask them, I go back 2-3 years in my questions and go, how much did you throw that year? How much did you throw this year? Because I know it's building up. Okay, so that's when Doc was talking, take a break. You can take a break, but if you're not strengthening in the off season, you're going to bomb. And that's what leads to these guys getting hurt. And then their mechanics become an issue. Okay, so the big things, like I told you, serratus, and this is how we test it. Gary looking good. So you bring your arm up, you're pushing down, you're feeling if the blade flies into your hand. Okay? Like I told you, I usually can use 2 fingers and pull anybody down. All right? And then here, this is a flip test. If this scapula flips out, and it's easy for a coach, this is telling me there could be a spinal accessory nerve problem or a long thoracic nerve. It's just nerves running here that control the muscles of these scapulas. Okay, so for the ATCs in the group or the coaches, this is a great test to test your kids. Can they resist you on this? If they can't, you got some problems coming. And if this flies out, then you also got some problems coming. What is GIRD? You hear the term all the time, and that's just glenohumeral internal rotation deficit. It's just you get a limitation on internal rotation because things are tight in the back, in a layman's term. Okay. All right. How we calculate it is you look at the dominant side and non-dominant side. So let's just take an example. Say his throwing arm, he measures 45 degrees, and the non-dominant 65. You take the difference and you divide it by 65. Anything over 20% is a problem. Okay? Phil Donnelly and Jeff Cooper and Scott and I were fortunate. We were part of the research. They measured 3,000 players from 1996 to 2007. And he was in the organization most of that time. What they found was if you had over 20%, that you had a 94% chance of having elbow or shoulder pain, or it had an elbow or shoulder injury. Okay? That's pretty high. And that's 3,000 players. All right? And this is what they also found is that pitchers with greater than 20% GIRD all have either had elbow or shoulder pain or a history of elbow or shoulder pain. All those guys they looked at, every one of them had a history when they're over 20%. Okay? And like I said, when they got the symptoms, when they got their GIRD below 20%, their symptoms resolved, unless they had something internally wrong. All right, how do you get rid of it? The best way, there's a lot of it, but the sleeper stretch is the easiest way. 2.5 years ago, Phil Donnelly changed it. We hold down the humerus now, approximately, put your elbow here and push down. The old way was hold the wrist and pull down, and we pinch our shoulder blades together, but we found that this works a lot better. Okay? This is simple. How many times do you do it? Now, if you're a coach or ATC, you just come from behind. If you're doing it, you hold their shoulder blade on the lateral border. When it comes into your hand, you stop right there. You hold it for 30 seconds, okay? And how many times do you do it? What we found is if you don't do it 12 times a day, you will not get better. There is no hope, especially when you're playing. There's just not a chance. So the guys that come in, how many doing a sleeper stretch? Oh, once or twice, Mr. Steve. I'm like, great. So we know that they're not going to pass. And we do not let them throw unless they are below 20%. Okay, so you have to get them below 20%. How do we test the core? Biggest thing we use a lot of ways, but Bunkies, it's called the Lino method. You can Google it. We want these guys to hold this position for 30 seconds, and we really want them 80 seconds. Okay? What they found in South Africa, where they invented these, is that when you can hold these for 80 seconds, the incidence of hip, knee, and ankle injuries goes down 99%. Okay? And for us, we want this because we want to generate a lot of torque to spin through, so we want this core to be strong, and that's what Scott and Angela were talking about. This is a simple test too. It's a one-legged squat test. Scott may still do this in spring training, I'm not sure, but you pass if your hips stay level and your knee doesn't buckle. If this knee buckles, then we know that his hip abductors are weak, okay? And that's the guy that's going to land and his knee buckled, okay? So if you ever see a pitcher's knee buckle, you need to go and test their hip strength, because that is the problem. It's not because they're winging through, it's that their hip is just too weak. They can't stabilize to explode forward. And just like only 20% in spring training can pass this test with one leg. Okay? And that's what Scott was talking about on diagonals. Everything we do is on a linear, we do it on all different diagonal patterns, okay? Because baseball isn't played on, just doing squats. All right. Real quickly, I just want to show you some things that we look at, and then we'll have some quick clips to get you guys out of here. But now you've heard the pitchers talk. Now, fortunately, Jay Wojtaszek and Matt Morrison, we all kind of think the same. Especially Jay and I. Matt and I only differ on one thing. But Jay pitched 12 years with perfect mechanics, and that's why he lasted so long. Jay can really see it, and Matt can really see it. So what we want to talk about is, the biggest thing you're going to see is, if you ever see them get straight at any point, you got a problem. Okay, you never want to see a pitcher's arm straight at any point. So the incidence of them hurting their medial elbow when they go straight is 98%. And it skyrockets when you have GIRD. Okay, so you never want to see them go straight. So we want them to loop up quick and be ready. So like they were talking about, when their foot hits, we want their arm up. These guys can never catch up. We call it disconnected. The range calls it disconnected. So we want these guys to get up quick. If they drop down behind them, one, they can see the ball anyway. A good hitter knows what's coming. And pitching is a sprint. It's not a marathon. So we want them as fast as possible, because one, the hitter cannot pick up what's coming, and two, it's healthier for them. Okay, so if you ever see anybody dropping down behind them, we got to get them out of that. Okay? Another thing you never want to see again is elbow straight. And then we talked about leading with your hip, okay? Keeping your center of gravity back. This is what it's about. When we come up, we want them to keep their center of gravity back, and then they can explode through, okay? For an upper level guy, this is 5-6 miles an hour. That's why they come, so they can get that. We can teach them that, but if they don't have what Angela and Scott are talking about, this core, we can't teach them that. Okay, so you want to keep your weight back and then come through. This, you don't have the hip rotation. If you don't have 45 degrees of internal rotation, they can't stay closed long enough to whip through. So they're going to open up too soon. So doing all those measurements, we already know what they do. Okay, so when we video them, we've already got our warning signs already, because we've already looked at it. Okay, so when they hit, then we want them to whip through. You never want to tuck your glove, okay? You never want to pull. Biomechanically, you get more advantage when you go towards the target. So when I played, I was always told to pull, and half your body's going one way, half your body's going another way. If it doesn't work like Jay was talking about, those are guys that are going to lean away, okay? So you never want this head outside this knee. So you always video them from the side, the front, and the back, okay? I don't know what it's called now, but UberSense, I don't know, it's got a new name, but make sure you video them front, side, and back. You never want to see their head outside the knee. I don't want to see the glove down here. I want it in front. You always take your chest to the glove, okay? We want them to release here. We want their knee bent 30 degrees, okay? You never want to see a guy lock his leg and come across. These are the guys that are going to tear their labrum off, okay? Because if you're slow here, you're always going to come across and pinch your labrum, okay? These guys always tear their labrum. And another quick one is, anybody that cocks their hand behind their head, they're going to blow their arm out eventually, okay? And every catcher we get who's taught how to cock, we got to get them out of that. All right, so catchers who cock behind their head, and look, I played a lot, and I was always told, you know, cock it. I'm like, that's like the worst possible thing you could ever do. The chances of you tearing your labrum and your UCL just skyrocket. Okay, so just trying to give you some quick things. But the big thing is you never want to see anybody get their arms straight. You never want to see them end across their body, okay? You want them to see them end out here, glove out here, head straight. All right, so there's just little things you can work on, okay? If they start falling off, this is when you're going to start seeing some elbow problems. All right?
Hi, I co-own a baseball training business, and I know there's parents here and coaches, and we give coaches clinics, and I'll ask a question, do you throw to warm up or warm up to throw? And the majority of the time, the coaches will tell me, throw to warm up. Could you emphasize that that's not correct?
Go the other way.
Yeah.
Yeah, I mean, we got all kinds of advantages, we got all day long, but, you know, and I know, talked about it a little earlier about just not having enough time to prepare, but we have an active warm-up every day before we do anything. It's the first thing we do. It's a dynamic warm-up, we do that before they pick up a ball or before that, and that's the same thing I would encourage at any level, whether it be high school or whatever.
Encourage them, if they're getting back to throwing and they're doing stuff, you know, get to the field 10 minutes early, run the field, break a sweat, get your whole body warmed up. Use some of your arm maintenance exercises as your pregame warm-up. You don't have to do a lot, but it's enough to get the arm and the blood flowing. You never just want to get to the field and start playing catch, and that's just a recipe for disaster. Next.
I work with players ages 10 to 18, and I like the idea of some sort of routine that they can do before they throw and after they throw, but where is the best place to get this? Where am I supposed to get something that I know is going to be safe? And it's something simple that I know kids can do on their own or will actually do. You know, when you get something too complicated for them, they try it and then eventually they just can't remember everything, or they just want to.
Are you talking like drills to?
Yeah, just things, anything, whether it's strengthening or stretching, any sort of drills they should be doing before they throw and after they throw, or before they pitch and after they pitch.
Yeah, like through the screen. And we do a lot of screens in the area. We give them drills off of the screen. When I look at their video, I can give them drills on how to get out of that. So we just target on what what we think is the most pressing thing, because you don't want to change too many things at one time. So like today, I had a parent there, brought a boy, a high school boy. I'm like, let's just change one thing. We were working with them. You know, there was like 5 things to change, but it's a process. Like I said, the quicker they get up, the better, okay? You never want to see them in a W. It's really just looping it up. I mean, I really don't know. Are you in Northern Virginia?
DC.
DC. She's the.
Yeah, well, I mean, I think the best thing, depending on the age group too, the younger kids, I give them a different program to do than the older, more, mature athletes. There's different programs. For the younger age groups, I mean, I know the Thor's 10 is a little bit outdated and it's not the greatest thing, but for that age grade and their skeletally immature bodies, I still think the Throwers 10 is a great resource for them to do. And generally, the programs that I give, whether it's my 10 to 13-year-olds, my 14 to 18-year-olds, I use that program pre and post. I usually tell them, warm up, get a set of 10 reps in there, and it's simple stuff that they can do that doesn't require a lot of equipment. And then post-game, post-practice, then you go through the rest of your reps, add some weights in, and do it that way. Split it up a little bit, and then once they get a little bit better and a little bit stronger, then we split up their programs and we do. Here's what you do on in season. Here's what you do postseason. Here's what you do days 1, 2, and 3. Here's what you do days 4 and 5, or vice versa, or intermix stuff. So use your resources around you. There's PTs in the area that can help set up programs like that. There's PTs that are willing to come and speak and give programs and do screens and set up some programs. I hate to give out just one program and tell everybody to do it, because not every kid is the same. Not every kid is matured at the same time, and everybody is different. Some kids need a little bit different space to go, doing different things depending on what their body and their requirements need. But reach out to your resources. The Throwers 10 is a great place to start for some of those younger kids.
I think if they do something.
Something's better than nothing.
Something's better than nothing. Now, is there, I feel that we like to screen as many kids as we can. And we did a free screen last year at his warehouse. We had 100 kids come in. And MedStar, we're trying to do more of those. But I feel that then you can individualize some certain exercises. But I think, like Angela said, if you're doing something, Throwers 10 is a good start. Is that something I use with my players? But I think at least they're doing something. It's important, because like I said, kids that throw and then they throw and then they take a break, did they really do anything to strengthen up? So, because they get tired, Even at 10 years old or 8 years old, we're seeing more kids come in at 8 and 9 years old than we've ever done.
And then those age groups don't necessarily need an elaborate program to do. A lot of those injuries are fractures and overuse because they're throwing year-round, and that's just too young for them, and their bodies just can't handle it. But a simple basic program that they can do to maintain, because all the literature tells us that over a course of just one season, whether it be spring season, you're going to lose range, you're going to lose strength. So we need to maintain that and then take the time in the off season when they are resting from throwing to do something. So, there's plenty of people in the area that can come and do that. I mean, we go into several high schools in our surrounding area, and we screen all of their baseball kids, and we get them on programs now, getting ready to start for the season. So,
I think if you have a good, like as a coach, if you've got you Google get some good extra stretches and the Throwers 10, that's a good start. I just think that as coaches and athletic trainers, physical therapists, if we get them younger, I'm big on trying to get them stronger and then correcting things that are going to lead to injuries. Like we asked Scott, what are who are at risk. The younger we get them, even the ones that aren't hurt, we just want to try to do more prevention as a group, So therapists, there's got to be we know some therapists in that area. But I'll be honest, you just want to work with somebody who's worked with throwers. And I worked under a genius, and he taught me. I'm blessed because I worked with him. Scott and I were lucky we had a mentor that guided us along. But you just want to be with somebody, there's a lot of really talented therapists, especially in Northern Virginia, but I'm not sure who to we have some thrower specialists here from Northern Virginia. We can give you their names, but getting somebody to come out and look at your team and screen them, the therapists, ATCs that are here, they'd be great they're a great resource to screen your kids. I think screening them, you're going to find some things. you know, they'll find some warning signs. They're too tight, they're not strong, give you some certain exercises for them to do as a group. But as long as they're doing something, I think it's better than nothing. I appreciate all you guys coming. I know it's late.